All right. Can you hear me?
Yes.
Great. One correction on what Allison said, married 46 years. So, which is not the easiest thing to do, but got lucky on that one. All right. So now we're going to do our annual Medicare review. And as we go through this, let me just make a disclaimer statement. It's a big subject. It's impossible to cover all aspects of Medicare in one meeting. I literally do probably 50 hours of continuing education every year on Medicare and always learn something new. For a complete description of Medicare benefits, there is a booklet put out by Social Security called Medicare and You. Highly recommend that you purchase it or obtain it. It's free. As we go through the presentation, feel free to stop me at any time and ask a question, even if it's just a definition of a word. Many of the Medicare premiums, deductibles, co-pays, and co-insurances have not yet been announced officially for 2026. So where you see figures in this presentation, they're either 2025 or a reasonable guess of what 2026 may hold. Okay. So much of this presentation is just a recap of Medicare so you understand how the system works. When you evaluate your Medicare program each year, it can be a fluid situation because of the changes that occur in Medicare, changes that occur maybe with your doctors being in or out of network, illnesses you may have, prescriptions you may have that are new. So it's a good idea to evaluate your Medicare program every year. Medicare has three primary programs. The first one is called Original Medicare, which is Medicare Part A, hospital, Medicare Part B, doctors. We'll be going into that specifically in just a couple of minutes. The next program is usually where a person like yourself adds a Medicare supplement to their original Medicare program and a drug plan. In that case, a person has access to all Medicare doctors and hospitals. They have a drug plan, and they have something called a Medicare supplement, also called Medigap, to fill in those things where you might have to pay out of pocket, like deductibles, co-insurances, co-payments. And then the last thing is something called a Medicare Advantage program. And this is what you see advertised on TV starting in about 2 weeks. This is what you get all the mail about. This is what you get phone calls about. By the way, if you get any phone calls from somebody soliciting Medicare Advantage plans, it's illegal for them to call you. Flat out illegal. They can't knock on your door. They can't meet you in the grocery store parking lot. The only way they can communicate with you is if you originate the communication or you respond to an email or letter. Everything else illegal. That doesn't mean it isn't done. It is. Okay. Part A, hospital, has four basic parts. Inpatient care in a hospital, skilled nursing facility. That's where you don't need to be hospitalized, but you still need to be under supervised care. And there are facilities called nursing homes or skilled nursing where you would stay, get 24-hour care. Hospice care, you probably know what that is, and home health care. We'll be covering each of these briefly. Part A has a deductible of $1,716. And this is a tricky deductible because it's per benefit period. Now, by the way, let me just back up one step. All of you probably have a Medicare Advantage plan or have HMO or PPO or have a supplement, in which case all of this is handled usually. So what we're talking about here right now is just the basic Medicare program before you add something to it. So the basic Medicare program has a deductible for hospitalization, and it's not a per year deductible, it's per benefit period, which is 60 days. So if a person was admitted to the hospital on January 1st, got out on January 5th, and then went back in 61 days later, new deductible. The first 60 days in the hospital, you pay zero for hospital services, not excluding doctors and surgeons. Then $4.19 a day for days 61 through 90, and $8.38 a day for days 91 through 150. You do have 60 lifetime reserve days. So if you're in the hospital for more than 60 days, you could tap into your lifetime reserve days and avoid having to pay the daily fee. Part A, skilled nursing. So skilled nursing care, for the first 20 days, you pay zero. Then you pay $209 a day through day 100. After day 100, you pay all costs. Skilled nursing care almost always requires a 3-day medically necessary inpatient hospital stay. So normally you can't just go straight into a skilled nursing facility. You must be hospitalized first. Note that the hospital deductible applies to skilled nursing facilities as well. And some Medicare Advantage plans, HMO or PPO, may be able to waive the 3-day rule. So far, any questions? Great. And if you do, and they're not a burning question that would kind of freeze your attention, I'll probably get to it later on in the presentation. Part A, hospice. So hospice, you pay zero for hospice care. You pay $5 for pain and symptom management drugs and 5% of inpatient respite care. What does that mean? So there's caregiver relief available for a hospice situation whereby the hospice patient can stay in a Medicare approved facility, hospital, skilled nursing, nursing home for up to 5 days. The whole purpose of it is to give your caregiver a break. Okay, Part A, home health care. So Medicare covers home health care services as long as you need part-time or intermittent skilled services and you have to be homebound. Home health care covers medically necessary skilled nursing care, physical therapy, speech language pathology services, and occupational therapy services. Part-time means less than 8 hours a day or less than 28 hours a week. So let's say a person had something that required uh, physical therapy and they weren't mobile, well, then you could have home health care to have somebody come in and do the physical therapy. Part B, doctors. So Part B helps cover medically necessary doctor services, outpatient care, like a doctor office visit, some home health services, durable medical equipment. That means a wheelchair, oxygen machine, CPAP, mental health services, limited outpatient prescription drugs under certain circumstances, and other medical services. You pay 20% for doctor services. Again, that's if you only have original Medicare and you don't have a Medicare supplement, and probably applies if you have a Medicare Advantage plan too. In 2026, the Part B monthly premium is going up again, and this time it's estimated to be $206 a month. Okay, Part B, preventative benefits. So here are just a few of the preventative benefits available to you at no cost. Bone mass measurements, screenings for cardiovascular disease, cervical cancer, vaginal cholesterol, prostate lung cancer, diabetes, glaucoma, depression. Mammograms, COVID vaccines, flu shots, pneumonia shots, and your yearly wellness exam. Now note on the wellness exam, it's sort of a simplified physical exam. If you have any blood tests done, you will pay for those blood tests unless those blood tests are done for a specific reason, like to measure your liver enzymes or your blood count. There has to be a medical reason why that doctor did the blood test. Otherwise, you're paying for it. Part B, acupuncture and chiropractic benefits. So acupuncture is covered for only low back pain. Medicare covers up to 12 acupuncture visits in 90 days. Chiropractic covers manipulation of the spine to correct a subluxation. You pay 20% of the Medicare approved amount and the Part B deductible applies. By the way, I forgot to mention that. So there is a Part B deductible of $257. I think it's going up. It's not official yet, but I think it's going up to $287, if I remember right, for 2026. So if you see a chiropractor, make sure that you're seeing them for a subluxation of the spine. If that chiropractor does x-rays, you're paying for them. So it's very important to make sure and you can always ask your chiropractor, what services am I getting that will be covered by Medicare? Even with acupuncturists and chiropractors, you must use Medicare providers. The way you find out if your doctor or acupuncturist or chiropractor is a Medicare provider is you either ask them or you can go to medicare.gov. It's easy to find. And note that Medicare Advantage plans and PPO or HMO have their own approved providers. We'll get to that a little bit later, but if you have a Medicare Advantage plan, HMO or PPO, you never ask, are you a Medicare provider? Because you might end up seeing a Medicare provider who's not in your network and you're going to pay the bill for that. Very important point. Okay, next up is Part D, drug benefits. So drug plans are either standalone, in other words, you get them with original Medicare and a supplement, or they're part of a Medicare Advantage plan. Drug plans have a deductible, usually. There's actually three parts to a drug plan. The deductible, it can be zero, but it can be up to $615 in 2026. They have an initial coverage phase where you pay a copay for the drug that you're getting. And then once your out-of-pocket reaches $2,100 in 2026, then you pay zero. It's a wonderful change in the Medicare drug system that was effective starting last year. You might have heard that term donut hole in the past. Gone, thankfully. Okay, more on Part D drug benefits. Medicare this year in 2026 is lowering prices on 10 high-cost drugs. Eliquis, Jardiance, Xarelto, Januvia, Farxiga, I guess, Entresto, Enbrel. You can see the list right there. Discounts range from 38% to 79%. Big deal. Like a lot of people I know take Eliquis, and it's expensive. Now, for a while, I was taking Eliquis too, and I can tell you that you might, if you see a cardiologist, you might ask them if they have any Eliquis that they can give you. My cardiologist was very obliging on that. I had a year supply virtually of Eliquis. Drug plan formularies change every year, so it's very important that you check your drug plan each year. Why? Because maybe the drugs you're taking changed and you can't just presume that they're covered under your current drug plan, or the formulary or list of drugs that your drug plan offers may have changed. Also, sometimes, in fact, every year virtually, the drug plan rates premiums change. So it's very prudent of you to shop your drug plan every year for premiums and to make sure that your drugs, any prescriptions you're taking, are on the plan. And I mentioned the next thing is that drug premiums do change. All right, now we're going to talk about original Medicare with a Medicare supplement. So with original Medicare and a Medicare supplement, you can see any Medicare doctor in the United States. Now, from a usage point of view, I think it's fair to say that there is nothing better than original Medicare with a supplement. Why? Because you can see any Medicare doctor. You would never say, is Dr. Smith in my network? Is Dr. Jones in my network? Almost all doctors are Medicare providers. There are different it doesn't matter which Medicare supplement you are on, whether you're with Anthem, Blue Shield, United Healthcare, Humana, you still have access to all Medicare doctors. People are frequently confused about this. So if you have a Medicare supplement with Blue Shield, you would never say, who are the Blue Shield doctors I can go to? You only want to know if the doctor's Medicare. So whether you have Anthem, Blue Shield, or any other insurance company, if you have a Medicare supplement, you can see any Medicare doctor in the country, and Anthem and Blue Shield would pay their share. There are different types of Medicare supplements. Currently, the richest one is called Plan G. It's not necessarily the most cost effective. It just has the richest benefits, but you pay more for it. So if the other one people sometimes consider is Plan N. If you have what's called old Plan F, which was the best one up until 2020, you really ought to do some price checking on that. Here's why. The main difference, the only difference between Plan F, which is the old richest one, and Plan G is that Plan F pays the $257 deductible for doctors. Well, if you're paying $100 or let's say $50 more per month for Plan F, that's $600 a year you're paying extra to save $257. And put that way, you would never do that. You would never say, oh, I want to pay $600 extra so I can save $257. So if you have one of those old Plan Fs, you might go shopping this year. Now in California, there's something called the birthday rule, which means regardless of your medical condition, if you have a Medicare supplement, you can go shopping for a different Medicare supplement on or after your birthday within 60 days of your birthday. So you could have a long list of medical ailments, but if you were born September 1st, then you have 60 days to go shopping for a different Medicare supplement, and sometimes you can save substantial premiums. Okay, Medicare supplement hospitalization. So for hospitalization, you pay zero for covered services. The only thing you might pay for is your doctor, because in 2026, there's a $288 doctor deductible. Hope all that made sense. More on original Medicare with a Medicare supplement premium. There's a monthly premium for Medicare supplement plans based on your age and your zip code. And the premium does usually increase every year. Oh, and here's the thing about the birthday rule. So if you live in California, you can switch to another Medicare supplement within 60 days of your birthday, no medical questions. You cannot be turned down. Okay, Medicare Advantage PPO. So now we're entering a different world. When you have a Medicare Advantage program, you are leaving the Medicare delivery world. Medicare is just a giant insurance company. When you get a Medicare Advantage plan, Medicare is no longer administering your claims. Just to give you a little background on this. So about 20 years ago, Medicare said to itself, hey, Medicare, could we be more efficient or cost effective? Would it be more cost effective if we contracted with individual private insurance companies to handle our claims? And that's what they did. So they created this thing called a Medicare Advantage plan, HMOs or PPOs. And if you get a Medicare Advantage plan, then you're working with the insurance company on benefits and claims and all questions. You're not ever talking to Medicare. Medicare still collects your Part B premium, but they're not interacting with you at all. It's entirely the insurance company that's interacting with you. So one of the Medicare Advantage plans is called a PPO. So a PPO means Preferred Provider Organization. So you can still see any Medicare doctor, but if you want to pay significantly lower fees, you see one of the doctors in the Preferred Provider Organization. Otherwise, you're going to have higher fees and higher out-of-pocket costs. With a PPO plan, you never ask the doctor, do you take Medicare? Your preferred doctors are in the PPO directory of either Anthem or United Healthcare. They're not in the Medicare directory. If you see a doctor who isn't in the PPO directory, you'll pay a higher portion of the bill and maybe even all of it. For doctors in the PPO plan, there is a copay or coinsurance. Copay means a dollar amount, $20, $40. Coinsurance means a percentage, 20% usually. If you're hospitalized, you will have a copay or coinsurance. Frequently with PPO plans in Southern California, there's a hospital copay of something like, let's say, they're all different, but let's say $400 a day for 5 days, and then you pay zero. So in that example, if you have a PPO and you're in the hospital for 5 days, you'll pay $400 a day for 5 days or $2,000, and then you're done. You could be in there 20 days, but you're capped out at the 5 days. Many PPOs. Oh, you also have an out-of-pocket maximum PPO. So that's like, if you had a serious medical condition or seen lots of doctors, at some point you would say to yourself, when do I stop paying out of my own pocket? And that's what an out-of-pocket maximum is. It tells you, worst case scenario, at what point do you stop paying anything out of your own pocket and the insurance company is paying everything. Many PPOs include a drug plan. Some include dental and vision, gym memberships, foreign travel, and other benefits. Now, the other benefits are getting richer all the time. There are what are called over-the-counter benefits that cover vitamins and various toiletries and cold medicines and flu medicines. There are some plans have a grocery benefit. Some have transportation to medical facilities as a benefit. And I might even be forgetting one or two, but it's worth looking into if you have a Medicare Advantage plan as to what are the supplementary benefits. Okay, Medicare Advantage HMO. Now, with a Medicare Advantage HMO, you choose a primary care doctor called a PCP. You see your primary care doctor for almost everything. If you're a woman, you don't necessarily have to see the PCP for gynecological exams, but everything else, you always you see your PCP and you route through your PCP for a specialist. And you can only see specialists in the medical group that doctor, your primary care physician, belongs to. As Allison said earlier, this is where people encounter trouble. And where Medicare gets a bad name, this is where it happens. Because sometimes people were sold or told that an HMO plan would be just like their regular Medicare plan, and it's not. You cannot see any Medicare doctor. You must see your primary care doctor. And for specialists, you must see specialists in that doctor's medical group. There are rare exceptions, like you need some exotic procedure and there's just nobody in the medical group that can do that. But 99.9% of the time, you must see a specialist in that medical group. If you see a specialist outside the group, you're paying the bill. Very serious stuff. And just, it's always, there's an old saying in the carpentry business, measure twice, cut once. So same with your medical insurance. Check and then double check so you don't find that you have a unfortunate outcome. Now, many HMOs and PPOs, but HMOs include a drug plan. Some include, I mentioned that already, I think. Some include dental and vision, gym memberships, foreign travel, and other benefits. Now, on the drug plan, again, it's very important that you check with if you have a Medicare Advantage HMO, that you check every year to make sure any prescriptions you're taking are on the formulary or drug list of that HMO, because they change. Okay, Medicare Advantage HMO, types of HMO plans. So there are different kinds of Medicare HMO plans. One is the regular HMO plan that you're probably familiar with. It's called a Medicare Advantage plan. There is a new wrinkle in the last 3 or 4 years that you may not be aware of. And it's going to be hard for you to kind of think with this. Some plans offer a Medicare Part B monthly reimbursement. Literally, sometimes a substantial reimbursement. Let me give you an example. Let's say your Medicare Part B premium is $187, and you have a Medicare HMO that gives $100 a month Part B reimbursement. Well, that means that $100 comes off your Part B premium every month, and you're paying $87. Now, there's a trade-off, and the trade-off is there's generally higher out-of-pocket costs. The hospital benefits might be more expensive, office visit might be more expensive, specialists, lab tests, and so forth. But I just wanted you to know that that is out there. If the premium is a particular problem and you're a very healthy person who doesn't, have a specific medical regimen they're on at the moment, this might be something that you would look into. There are also another kind of Medicare Advantage plan is called a chronic special needs plan. So these plans are designed for chronic illnesses like heart disease, cancer, and diabetes. Now, with a chronic special needs plan, the HMO has been customized to your specific medical situation, with the result that your personal out-of-pocket costs will be reduced almost to zero. So specialized HMO plans for specific illnesses, uh, heart disease, cancer, diabetes, and a couple other less well-known ones. A person can enroll in a special needs plan any time of the year. So if a person had a regular HMO in March and they ended up with maybe heart disease in April, they could switch to they could change their Medicare HMO to a special needs for heart disease HMO right away, first of the following month. I hope that made sense because it's an important point. Another kind of Medicare HMO is for special needs called dual, DUAL. So if a person is on Medicare and Medi-Cal, depending on the level of their Medi-Cal qualification, there can be little or no cost for Part B doctors, hospitals, tests, or drugs. And you have to qualify for Medi-Cal based on your income. There are trade-offs on that. You might have a more narrow doctor network. You might have a more narrow hospital network. There might be services you can't get because it is an HMO after all. But if you're in a financial condition that, we're paying for the Part B premium and medical services is a burden, then you might consider Medi-Cal. Okay, here's just a graphic of how a Medicare Advantage HMO works. So you have your primary care physician in the middle. You always see that person. And then they route you to specialists in their medical group. Okay, annual enrollment period. So open enrollment is from October 15 through December 7. During that enrollment, you can change your drug plan. So this is when you would go shopping and make sure your drug plan is the most appropriate one for your circumstances. You would either have your broker do that shopping for you, or you would go to Medicare.gov and you can shop your own drug plan. During the open enrollment, you can change your Medicare Advantage plan. So if you have an HMO or a PPO, you can change your Medicare HMO or PPO. Reasons you might do that would be maybe your doctor doesn't belong to that HMO anymore, but he belongs to a different one. Or there are certain benefits available in a different HMO that you want to take advantage of. Or you like that Part B reimbursement where it lowers your monthly premium for Medicare. So this is the time of year when you could change your Medicare Advantage plan. You could also, if you have original Medicare, like with a supplement, for example, this is the time of year when you can join a Medicare Advantage plan. So you would drop your Medicare supplement and you would join a Medicare Advantage plan. And you can also do the opposite. You can leave your Medicare Advantage plan during this open enrollment and go back to original Medicare. Now, if you want to get a supplement, possible, but not guaranteed. So let me just lay this out as clear as I can. So let's say you have a Medicare Advantage HMO. And you're not happy with the doctors you can see, or maybe there's a specific doctor that you would like to see who isn't in the HMO, but he is a Medicare, he or she is a Medicare doctor. So if you're a Medicare, and let's say you have a medical condition where if you just tried to buy a Medicare supplement, you would be turned down. Well, there's a rule that if the Medicare HMO plan, oh, excuse me, I'm just gonna wet my whistle a little bit. If the Medicare HMO or PPO plan worsened by at least 15%, even if the drug costs worsened, I mean, it can be small things that if they worsened, that opens up a special enrollment opportunity, and you can sign up for a Medicare supplement plan, no medical questions. So I'm going to walk through this again because this can be really important to someone. Let's say a person has a Medicare HMO, and for some reason they're not happy with it. If that Medicare HMO worsened even just a little bit, that opens a special enrollment period, October 15th through December 7th, whereby you can leave the Medicare HMO and enroll in a Medicare supplement, guaranteed. Back to October 15 through December 7. Number 3, you can make more than one change during the annual enrollment period. That's what it's called, annual enrollment period. But the last change you make will be the one recognized by Medicare. Okay, what does that mean in the practical world? So on October 20, some broker convinced you to buy a Medicare Advantage plan with ABC Health. And you did, you signed up for it. But 2 weeks later, you realize, whoa, my doctor's not in there. In fact, I don't like this ABC Health plan at all. Well, you still can sign up for another one. It's not too late. You have more than one opportunity to sign up for a plan during October 15 through December 7. So if you made a boo-boo signing up for a plan, you can change it. All right. Now there's another kind of open enrollment. So, we just went over the regular open enrollment that everybody's familiar with from October 15 to December 7, but there's a second open enrollment. You don't hear much about it because brokers are not allowed to promote it. This is an educational seminar, not a sales seminar, so I am allowed to tell you what it is. It's called the Medicare Advantage Open Enrollment. So from January 1 through March 31st, you can switch from one Medicare Advantage plan to another one, or leave your Medicare Advantage plan and return to original Medicare. So, example, in November, you left your current Medicare HMO and you sign up for another one. And by February, you've realized bad mistake. You shouldn't have done it. Well, good for you. Fortunate for you, you're in another Medicare open enrollment period where you can switch again. And that runs from January 1 through March 31st. You can only make one change, however, during this open enrollment. So whatever change you make during this open enrollment, that's the only one you'll be allowed to make. And the reason why brokers aren't allowed to promote this is Medicare doesn't want brokers out there trying to get everybody to switch their Medicare Advantage plan, particularly if it isn't to the client's best interest. Okay, now there are other open enrollment periods. You're probably figuring out this is a complicated subject. So the other circumstances that initiate a special enrollment period include you have a Medicare HMO or PPO, and you move out of the service area. You live in LA County and you move to San Bernardino County. Well, now your LA County HMO is invalid. And this opens up a special enrollment period during which you can now move to a plan in San Bernardino County. It also opens up the opportunity to switch from a Medicare HMO to a Medicare supplement. So again, if you're in one of those circumstances where you're not really happy with your HMO and you want to have a the broad list of Medicare doctors and services available to you. If you move out of your HMO service area, that opens up a special enrollment opportunity, and you can now get a Medicare supplement. Another special enrollment period is if you're leaving an employer group plan, like maybe you kept working after you were 65 and now you're 70 and your employer's been paying the premium the whole time for you. So you've kept the group plan, but now maybe they're charging a premium or you're going to retire. That opens up a special enrollment where now you can get into Medicare without any penalties. Another special enrollment period is if you're entering or leaving an institution like a skilled nursing facility and you have the opportunity to change every month. There's another special enrollment opportunity that we're familiar with here in Southern California, natural disasters like fires. If they inhibit your ability to have used a Medicare open enrollment opportunity, then you have another new special enrollment. For example, because of the Palisades fire, which has been a year ago, maybe, people are still able to switch their Medicare HMO plan to a different one because of that circumstance. Anyway, okay. Wow. Okay, we're near the end. I guess we are at the end. Let me just summarize a couple things before we open it up to questions. Complicated subject. So many potential mistakes a person could make. Don't be shy about calling your broker and confirming your prescription drugs, confirming your primary care physicians, or call the insurance company themselves to confirm the drugs and prescriptions. You just don't want to be in a position where you're surprised. So don't be bashful on that. It's their job. Broker or insurance company, it's their job to service you. Any other highlights? Gosh, there's so many things. Okay, I think I'm going to open it up to questions. So